All right, we are going to do an IV bolus push med and an IV piggyback. And I will follow the checklist. I have all of my supplies laid out. I have my doctor's orders. I have my medications. I have my needle and syringe. I have my secondary piggyback tubing, my label, and my syringes. As I have my gloves and my hand wash, which I will do now. First thing I will do is check my MAR to see what my orders are. My orders are for normal saline running at 1,000 with 20 milligrams of potassium to run at 125. That's what we have running here into Shirley. My second order is morphine sulfate, 4 milligrams IV push every 2 hours, PRN for pain. And you are having pain, aren't you? Vancomycin, 1 gram IV daily. That came in a, we will say this is a 250 milliliter bag, and we will run that over an hour. H&H in the morning, which is ordered. Bed rest with bathroom privileges, and diet is not tolerated. So I will go in and do my identifiers. Hello Shirley, my name is Roberta. I've come to give you some medication. We'll start with some pain meds, and then I have an antibiotic to run. Put on my gloves. Can you tell me your name and date of birth? Yes, my name is Shirley and my date of birth is 5/14/1932. That's a good year, Shirley. Thank you. All right. Have you ever had morphine before? Yes, and I tolerate it well. Well, that's good to hear. Check your allergies. Your allergy is to penicillin, so our allergies are good. Are you allergic to morphine? No, I'm not. That's good to hear. So I prep my syringe, put my blunt on. I have my morphine here, morphine sulfate, 2 milligrams per milliliter. And my order is for morphine sulfate, 4 milligrams IV push. So 2 milligrams are in 1 milliliter. So I'm going to give 4 milliliters, which will be 2 milliliters. Right.
4 milligrams,
4
which will be 2 milliliters.
4 milligrams and 2 milliliters, yes. All right, let's take in 2 milliliters of air. I'm gonna wash this off, scrub, 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 scrub. And I'm going to inject 2 milliliters of air. And I will suck back until I reach just past the 2 there. I will take that off and I will depress 2 until it comes up to 2. So I have 4 milligrams of morphine in 2 milliliters of water, or saline. All right, we have that ready to go. I have my vancomycin here and my tubing, and I will label my morphine. And this will say morphine, 4 milligrams, given by Roberta, drawn up on date September 12th, 2022 at 2 o'clock in the afternoon. I will tape this to my syringe, if I can get the tape off. There we go, taped. All right, so Shirley, let's start with your morphine here. I'm going to assess for any inflammation. There is no inflammation here. Her IV looks good, and I will flush with alcohol. I haven't done that yet. I will check the medication label in the MAR and the healthcare provider order again because I'm in the room. Morphine. And then I will check the medication label, and my medication matches my MAR. I drew up my medication already, and I will cleanse her port for 30 seconds. Does it say? Yep, 30 seconds. And I will flush with 3 to 5 cc's. If your patient has IV fluids running, you can unhook this, do your cleansing, and do your flush. So there is 3 to 5 cc's. I will open up my medication. And the first 1 to 2 milliliters should be administered at the same rate as the medication. So we are going to give 1 milliliter over 30 seconds. So we'll give this, wait 15 seconds. And then we will push again for another 15 seconds. I like to count, I like to visit, I like to talk about what's on TV because you never know what's going on. Give another 15 seconds. Wait a little bit. And give the last little bit. There we go. Very good. So we're going to discard this flush. It may have more in there, but it's been laying open. We'll open a fresh flush and we will flush our medication through with another 5 cc's. At Trinity, they actually have 5 cc flushes, so we won't be wasting all of this. All right, so I'm going to hook her back up to her IV fluids. And let it run.